When the novel coronavirus began to spread around the globe in early 2020, many were pinning their hopes on herd immunity as a means to end the pandemic, a slow process in which a majority of the population becomes immune to the disease, making the transmission harder. But scientists began their studies on the contagion from early on to understand the virus and produce a vaccine. The Pfizer-BioNTech vaccine became the first to obtain the World Health Organization's approval for emergency use, offering the world a glimmer of hope in the fight against the deadly respiratory disease. Months later, however, the world is still struggling with the pandemic and its impact on the lives of its 8 billion inhabitants. While new cases and deaths have sharply fallen in richer nations, poorer countries, including those in Africa, are witnessing soaring infections and fatalities. Many observers, including the WHO, attribute that to vaccine inequity.
6 months since the first vaccines were administered, high-income countries have administered almost 44% of the world's doses. Low-income countries have administered just 0.4%. The most frustrating thing about this statistic is that it hasn't changed in months. Inequitable vaccination is a threat to all nations, not just those with the fewest vaccines.
Well, I think that it's never too late if you're talking about saving lives around the world, but I believe that it's absolutely true that we should have approached this pandemic as a global problem from the very beginning. If all of the countries had teamed together and distributed the vaccines across the globe early on, I think we would have seen much, much less death and devastation due to this pandemic. So, yes, it's wonderful that some countries are stepping up now and offering doses of the vaccine, but absolutely this should have been done, 12, 13, 15 months ago.
Human rights groups and charities are calling on the world's richest nations to do more to help bring the pandemic to an end. Ahead of its visit to the United Kingdom to attend the G7 summit, U.S. President Joe Biden unveiled America's plan to help poorer nations fight the COVID-19 outbreak.
The United States will purchase 500 million doses of Pfizer's COVID-19 vaccine to donate to nearly 100 nations that are in dire need in the fight against this pandemic.
Other G7 nations have also pledged to chip in to meet the group's 1 billion dose target. In the meantime, health and anti-poverty campaigners say while the G7's pledge is a step in the right direction, it falls short of the number of doses needed to win the battle against the pandemic. Charity organization Oxfam said, to end the COVID crisis, the world needs 11 billion doses of vaccines. It also called on the G7 to support a push for a waiver on the intellectual property rights behind the vaccines, a move that would give other nations better access to the much-needed jabs.
I think that the amount of doses being offered are absolutely a drop in the bucket, and we've seen certainly here in the United States that the country was very, very cautious about releasing doses, hoarding doses really, of the vaccine for a very long time. Partly with a notion of protecting the local residents first before sharing vaccines with the rest of the world. And I do think this is a very short-sighted approach because the vaccine does not know boundaries. The vaccine does not know national borders. And so as we've seen with the way the pandemic spread, you have to vaccinate the entire world in order to protect everyone in the world. So the idea of reserving doses just for your own population, I think, is very, very short-sighted on the part of all of these countries.
According to Johns Hopkins University, over 2.2 billion doses have been administered worldwide as of June 12, 2020. At this rate, several countries are expected to fall short of the WHO's target of inoculating 10% of their population against the infectious disease by September.